Hello, and welcome to my podcast, The Chemistry of Life, where we explore the intricate world of health, wellness, and how it relates to chemistry. I'm your host Rudransh, and today we are with Dr. Gaurav Bhalla, a physician who works at Max Clinic.
So good evening, Dhuransh. I am Dr. Gaurav Bhalla, consultant physician and diabetologist in Max Group of Hospitals. So I'm working presently with Max Hospital as well as I have my own clinic in New Delhi. Basically, a physician that is who specializes in internal medicine. That is, I treat patients who are suffering from infections, diabetes, thyroid disorders, cardiac patients. So all these kind of patients who are dealing with routine physician problems, we are dealing with those patients.
Okay, now let's talk about medicines for hypertension and blood pressure.
So again, as we all know that hypertension is again a common, disease which is, very much prevalent in Indian population. So the common drugs which are being used these days are angiotensin converting enzyme inhibitors, that is the ramipril, enalapril. Then there are angiotensin receptor blockers, ARBs commonly known as, which includes telmisartan, olmesartan, candesartan. Then we have calcium channel blockers, which include cilnidipine, amlodipine, and again we have beta blockers, that is metoprolol, atenolol, which are the commonly used beta blockers. Carvedilol also, which is a common beta blocker which is being used nowadays for the treatment of hypertension. So these are the different class of drugs. So commonly used, it is A, B, C, D for hypertension. A stands for ACE inhibitors or ARBs. That is again, as I told you, that telmisartan, olmesartan, enalapril, captopril. B stands for beta blockers. So that is again metoprolol, atenolol. For C, it is calcium channel blockers, amlodipine, cilnidipine, and D stands for diuretics. That is hydrochlorothiazide and chlorthalidone. These are the common diuretics which are being used for the treatment of hypertension. So, patients who are having their systolic BP from 120 to 140, 139, they are actually pre-hypertensive patients.
I see.
And who are having their diastolic BP from 80 to 89, they are having diastolic, they are pre-diastolic hypertensive.
Okay.
So the normal cutoff limit for a patient to be known as a hypertensive, it is the systolic BP should not be more than 140 and the diastolic BP should not be more than 90. If it crosses 90, patient is labeled as hypertensive, and again, again the systolic BP, if it crosses 140, again the patient is labeled as hypertensive. So these are the different class of drugs which normally we use in daily practice to control blood pressure in a hypertensive patient. So specifically, if you want to ask, then the commonly used drugs are ACE inhibitors and ARBs. Secondly, are there calcium channel blockers. Also, diuretics have also been come up lately for the treatment of hypertension. Sorry.
So, what exactly causes hypertension?
See, again, there are many factors. First is the essential hypertension, which is normally also known as the primary hypertension. The most common cause for this is genetic. So it is mostly hereditary. That is, you can get it from your forefathers or from your father. So, and the secondary hypertension, there are many other diseases like pheochromocytoma, secondary hyperaldosteronism. These are the various other diseases which lead to hypertension, like Cushing syndrome also. So these are the different diseases which causes hypertension. But primarily, which we see in Indian population, commonly which we see in Indian population is the primary hypertension, which is more commonly because of hereditary and genetic factors. So other factors like the lifestyle, again, high salt intake, fried food, and also sedentary lifestyle, obesity, again, along with diabetes, it also increases the risk of hypertension.
I see. And the hypertension medication,
Right.
does it have any side effects in the body?
There are various side effects, like the ARBs I talked about earlier and the ACE inhibitors. The primary side effect is, cough. People, the patient may complain you of, intractable cough. The cough is not settling with any, medication. Then there is, increased the levels of potassium may increase because of ACE inhibitors and ARBs.
Okay.
Also, these drugs shouldn't be given renal patients who are having high potassium levels, because as we know that the kidney patients have their potassium levels on the higher side. If we give these medications, that is ARBs and ACE inhibitors, they can increase the levels of potassium in their blood and eventually lead to cardiac effects. It can lead to cardiac arrest also.
Okay. Okay. So the medicines they increase the level of the minerals and not decrease it.
I'm talking specifically of potassium.
Okay.
It's not about other minerals. It's specifically of potassium. These class of drugs, they're known to cause hyperkalemia. That is the increased levels of potassium in the blood.
So you also spoke about cardiac arrest. So let's say a patient is not suffering from a kidney disease.
Right.
Do they have any like heart problems after consuming such medicines?
Because of medicine, are you talking about?
No, because of the hypertension medication.
No, most of these drugs are cardiac safe.
Okay.
They don't cause any effect on the heart. But as a side effect, that is again, if the potassium level rises in blood, it can eventually lead to cardiac arrest. But per se, by the use of these drugs, nothing can happen to the heart. They are cardiac safe. They are very much recommended for the treatment of hypertension.
And is there no strain put on the heart either?
No, they are definitely they are being used to decrease the strain on the heart rather than putting any strain on the heart.
So somebody who has hypertension, their heart has a lot of strain on it.
Yes, obviously
Because
it has to pump against the the resistance of the arteries.
Okay.
So the heart needs to pump approximately around 5 liters of blood against the resistance of the arteries. So it needs force, and if the force increases, the BP increases. So these medications, they eventually decrease that force so that the heart could pump effectively, and if at all the cardiac function is compromised, then the patient may land up into heart failure. That is the retention of fluid in the lungs, which is again a cardiac emergency, and eventually the patient has to be hospitalized for those kind of disease.
I was wondering if anybody suffering from hypertension. So do they has it ever happened that somebody's nerves, veins, or arteries have like bursted or have had a puncture in that?
Yes, it can happen. Patient can have stroke, that is paralysis. They can have brain hemorrhage. Also, they can have heart attacks because of high BP. So it is very much recommended that if you are having persistently high BP, you should definitely go to a doctor, get yourself treated so that your BP is in normal range, and eventually you can prevent yourself from complications such as stroke and heart attacks.
Okay. And how exactly, like, let's say that ever happens, how exactly is that controlled or healed?
Again, we need to take care of the blood pressure. Again, we have medicines for that. Those are different kind of injectable medicines which are used for hypertensive emergencies. Like we have labetalol, which is a IV beta blocker, which can be used in these kind of emergencies. We have sodium nitroprusside, that is again a hypertensive emergency medication which can bring down rapidly your blood pressure and control the bleeding in the blood, because more the blood pressure, the bleeding will keep on increasing. So that is why we need to control the blood pressure eventually, so that we can keep the bleeding to a minimal level.
And are there any problems like with the fluids of the body outside of the veins that are entering inside, or is that not a problem at all?
So basically, blood pressure is mainly, see, the systolic BP again. Eventually, it is because of the increased load on the heart. That is the preload. So eventually, the heart has to pump against the resistance of the arteries to increase the to control the blood pressure. So eventually, the extracellular fluid doesn't play a much important role in raising the BP. It is more the resistance of the arteries which is responsible for the raised BP. But yeah, if the patient is in overload, sometimes he may experience high BP.
Overload as in like stressed?
No, overload, yeah. It's not about overload. I mean to say some patients who are having heart failure, who are eventually in heart failure, they have collection of fluid in their lungs. So what happens is exactly the heart is not pumping up to its normal capacity. So what it does is it starts pumping against the force, and eventually it pushes the heart into much more strain, which was earlier, and eventually it lands up into more failure.
So how exactly is this force exerted on the heart?
Again, if the resistance is high in the arterioles, it has to pump against the more the resistance, and eventually the blood pressure is going to rise.
Thickness of the artery walls.
Yes, eventually the cardiac musculature which is there, that is the cardiac muscle thickness. There is hypertrophy of the heart walls. So the left ventricle initially, the left ventricle is a chamber of the heart. On the left side, it eventually
that pumps straight to the aorta.
Yeah, so that eventually the thickness of that increases if the BP increases.
I see.
That is the load I am talking about.
Is there anything that any like particular thing that we consume or any chemical that increases the thickness of the arteries?
The increase in the cholesterol levels in the blood, High salt intake again is responsible. So these two factors are mainly responsible. I would suggest again the diet and exercise plays a major role.
So,
If the patient is exercising, effectively, his arteries won't develop such cholesterol depositions. So that is why his BP, there are chances that his BP will be on the normal side rather
I
than on
see.
the
So
high
that's
side.
why it's more of a problem in India because the high salt intake.
High salt, high fatty foods, high fried
Can
foods.
temperature also play as a factor? Because if it's extremely hot, then
It has been noticed that in cold conditions,
Okay.
there is slight increase in BP by 10 mmHg,
I see.
and more in evenings also it has been seen.
Okay.
So there is a slight variation. I would not say that it is for every person, but sometimes yes, in some patients we have seen that in cold extremities and as well as during the evening time there is slight increase in the blood pressure.